So, good evening, friends. So, we are discussing about the aphorisms from the sixth edition of Organon of Medicine, and we are going towards the fifth aphorism. Again, a very important aphorism from the sixth edition because it defines exactly how to approach. So, in the first aphorism, he mentioned the mission, then he defined mission in second aphorism, that is in the form of ideal cure. Then the third aphorism, the qualities of homeopathic physicians in order to achieve his mission. Then, after that, he has explained one more thing, one more quality in the fourth aphorism, that is the preserve of health. So, all the qualities of homeopathic physician one should born with, and one should develop in themselves. First is knowledge of disease form indication. Second is knowledge of medicinal powers. The third, the choice of the remedy, the medicine indicated. The fourth one, that is the proper dose. Number five, the repetition of the dose. And number six is the obstacles in the process of recovery. And seventh one, which was explained in the fourth aphorism, like is likewise the preserver. So preserver of health. So these are things which we have discussed in length, as well as in our first footnote we have discussed about the theoretic medicine, a criticism against the allopathic medicine done by Hahnemann, explaining that it goes more theoretically than of a practical approach, giving big names to the diseases without treating them, and that he criticized over there. Today we have to start with the fifth one. So see, in the first aphorism, when he defined it, immediately he explained the definition, then he explained how the homeopath should be. And then when going towards the fifth aphorism, he explains exactly what knowledge of disease, comma indication. And he starts in the fifth regarding the knowledge of disease. So we'll start with the fifth. We'll read it. Every sentence from this fifth aphorism has a big meaning. So we have to go gradually. We have to learn every sentence from it, and we have to understand what he wants to explain in the fifth aphorism. Up till now, for the students who are exam going students, I want to explain that I have given many examples, which are the questions which are asked in the examination. So all the questions I have explained to you. The first aphorism itself in detail is a question for the exam. Second aphorism, highest ideal of cure, is a short note topic. Third aphorism, qualities of homeopathic physician, short note topic. True practitioner of healing pot, short note topic. Preserver of health, short note topic. Theoretic medicine is short note topic. So this is what from exam point of view. Now we'll go toward the, again, two things, exam point of view as well as a practical approach in your practice. So fifth aphorism, he says over there, useful to the physician in assisting him to cure are the particulars of most probable exciting cause of acute disease. Underline this, exciting cause. And again, a short note topic. And what he explains, exciting cause of acute disease. So basically, exciting cause is always behind the acute disease. Generally, the indisposition or the individual diseases of acute variety, they are caused because of the exciting causes. So what are exciting causes? When you think about the exciting causes, they might be a physical, they might be a psychological. So it might be any psychological. Anyone says, anyone curses against you, that might be exciting factor for you. Someone just looks with anger towards you, it might be exciting factor for you. Sometimes it might be physical, that in the form of some physical trauma, that might be exciting factor. Sometimes it might be chemical, some poison enters in your body by mistake, is again exciting cause. Sometimes it might be a food poisoning in the form of chemicals. Sometimes it is biological in the form of some some biological entity enters in your body and affects your body. That is a biological, or changes which happens in the biology because of some external changes. That is one more reason. So all those things creates a problem and produces acute disease. And one must understand what may be the exciting cause behind the acute disease. And when you know that, it is just a duty for you that remove that exciting cause and disease will be recovered. So there is many a times The first variety of the acute disease, that is indisposition or individual disease, never requires a treatment if it is of a mild character. But indisposition of a severe character always requires a homeopathic treatment, and it is based upon the totality of the symptoms. So, this is what he wants to explain over there. Useful to the physician in assisting him to cure are the particulars of the most probable exciting cause of acute disease, as also most significant points in the whole history of chronic disease. Now, what he wants to explain about chronic disease, and what he says, most significant points in the whole history of chronic disease to enable him to discover its fundamental cause. So chronic diseases are always because of fundamental cause. And fundamental cause, generally everyone considers that fundamental cause means all three miasms. All three miasms are not fundamental causes. It is basically the sora. Hahnemann have explained significantly, even in further aphorisms, and mentioned about it. Sora is the fundamental miasm, and which is the basically miasm which is responsible even for production of acute varieties also. Acute diseases may be produced because of the excitement of the soric miasm. So sora is in background, always behind the acute disease also. So if a patient's case is chronic, he is suffering from any chronic disorder, and you don't have a symptomatology, the characteristic symptomatology, and then you have to prescribe for that patient, means you have to find it out the background sora, the fundamental cause. Hahnemann says how to investigate a fundamental cause. See, these are the points which are very, very, very essential when you deal with the patient. That's why I said that yesterday I told you that this aphorism gives you exact idea how to investigate a chronic disease. Acute is very simple. When you deal with the patients in acute, everything is self-evident. Everything is present in front of you. You don't have to ask many more questions in acute because everything is self-evident. It is explained to you by patient himself, and which is of a recent origin. But in chronic, patient comes with certain one-sided disorders many times. Patient comes to you with pathological diagnosis sometimes, but he lacks the characteristic symptoms. And when he lacks the characteristic symptoms, you cannot reach to the right remedy, because the common symptoms never gives you a right remedy. And when to find it out a remedy for that patient, it is needed to investigate a fundamental cause. That means you have to understand the background of the patient. So how to investigate the fundamental cause, which he explains over there. So what he says, to enable him to discover its fundamental cause, which is generally due to the chronic miasm. And then he explains, in these investigations, means when you have to investigate the fundamental cause, number one, just write over there on your book, number 1 point, the ascertainable physical constitution of the patient, especially when the disease is chronic. पहिला point काय दिलाय? What first point he has explained over there? Ascertainable physical constitution of the patient. What do you mean by ascertainable? Ascertainable means visible, visible to your naked eye. So you are dealing with the patient, patient is sitting in front of you. What you are observing the patient. Ascertainable means what is visible to your naked eye. So patient is sitting, patient is standing in front of you, all things regarding his physical constitution that you have to look for. Whether he is short statured, whether he is averagely built, whether his height is too much, whether he is slim, whether he is fat, whether he is short neck, whether he is elongated neck, whether it is emaciated neck, whether his ears are big, whether his ears are small, whether it is nose which is depressed, small, whether it is long nose or it is knobby nose, everything, right from the top head to the foot, each and everything which is visible to your naked eye is very important to find it out or consider the constitution of the person. That defines many times in your remedy, the constitution is defined in the first two sentences. When you open the Allen's notes or Borix Remedica, first two sentences are always related with these things. So first two sentences always defines what is the constitution of the person. So if you open the phosphorus, the constitution is written over there, the tall, slender, weak, emaciated, narrow-chested personality. Same is true for the tuberculinum. So this is the constitution, which is one visible thing which guides you towards certain things, which guides you towards the mayasam, which defines what may be the mayasam. It doesn't mean that it will going to give you directly a remedy, but it will definitely help you to reach to a certain level. So if you are not getting anything in your case, at least you look for what is there. If the patient is sitting whose skin is so delicate, it is so visible naked to your naked eye, and you can find the transparency of the skin, it's the phosphorus skin, ascertainable physical constitution, which gives you idea. You might get a patient who is sitting in front of you having a big hairs over there. That is one point which you can find it out. Another patient, there are no hairs. In some patients, you might get alopecia areata. Immediately you can find it out. This is what present over there. If in some certain patients like a calcarea or a platina, they have big head. That you can find it out over there. So constitution, you get many more things. The tongue is one part of the constitution. The different types of tongues mentioned in our materia medica, which guides you toward the remedy. Is you have a flabby tongue with imprints of teeth, with a lot of cracks on the teeth, with aphthous ulcers. It is a Merck tongue. If it is a tongue which is triangular red tip at the triangular red tip with a little bit coating on the back side, is the Rustock's tongue. So tongue itself is one of the part of ascertainable physical constitution. The teeth of the person, you can find it out, and that you can immediately think about the remedy or immediately think about the person. So crown of the teeth is decayed in Merck's. The edges are carried in Staphysagrria. The root of the teeth is decayed in Thuja. So these are the things which are visible to your naked eye. The person who is sitting over there like stoop-shouldered and he is like this, then you can think about stoop-shouldered, the sulfur, better manner. So every person is having a different constitution, and that constitution guides you towards the remedy, or that guides you towards the mayasam. For example, another example we can take the psychotic personality. In psychotic personalities, the neck is short, very short neck, and they don't have a neck too much. They are short stature, but a pot-bellied abdomen. So this is very typical with the psychotic personality, the psychotic constitution. The syphilitic is either too tall or too short. Those are syphilitic. Tubercular is tall, slender, weak, emaciated. So you get idea about the miasm on the basis of ascertainable physical constitution. You can see the skin, the absolute dryness of the skin, which you can get in sulfur, which you get in soranum. It is a typical feature of the psoric miasm. The nails, the brittle nails, the characteristic of syphilitic miasm. If it is fungus, we can find it out on the nails. It is a characteristic of a tubercular miasm, a ringworm miasm. So physical constitution is one important entity which guides you towards certain things. So if you are not getting remedy by characteristic symptoms, the ascertainable physical constitution gives you a certain aspects about understanding the patient. The face of the patient. You can watch the face of the patient and face is absolutely greasy. Yes, physical constitution, one of the part which you can immediately find it out. So these things defines many more things, guides you towards many more things. Hairy skin, whole body is full of hairs. Suja. Then you can get in females there is a big hairs on the chest, chin, or even upper lip. That rubric is there in your face chapter of the complete repertory. You get the remedy. So these are the things which you are visible to your naked eye and which you can find it out very easily. This is what is called as a ascertainable physical constitution. And this is what Hahnemann wants to explain, that individuality is hidden in ascertainable physical constitution. Sometimes patient is sitting in front of you and his nose is like just doing this. I cannot do it so that you can see, but it is not possible for me to do that. But it is present with certain people. They have the habits of this. You can get the rubric directly in your face chapter or nose chapter, motions of the wings, fan like. That is ascertainable, that is visible to your naked eye. Some patient comes to you, there are cracks at the corners of mouth. And if the cancer is there, it is condurengo. Immediately you can reach to the remedy, cancer associated with cracks at the corners of mouth. If it is the cracks which are present over there, as well as at the center, the lower lip middle, it is natrium muriaticum. A visible thing, ascertainable physical constitution. Sometimes patients are there with atypical fever blisters in the damp weather with triangular red tip in the rust of ascertainable physical constitution. If it is recurrent fever blisters which you can get over there again and again, is natrium muriaticum. See, these are the hints which provides you to the hints for the prescription. You can reach toward the prescription with the help of that. The palms which are warm and sweaty, indication of hyperthyroidism, at the same time indication of natrium muriaticum. But palms are too much warm and sweaty. If they are absolutely cold and sweaty, is the characteristic of silica. If it is offensive, palms and soles, then it is definitely a silica, ascertainable physical constitution, which you can observe over there. So these are many more things which you should not miss in your case taking. And that's why Hahnemann says, these are the things which guides you towards certain entity and which are visible to your naked eye. Even if you open the Kent's repertory and head chapter and just go with the hairs, you can have many more symptoms. If the patient who is having a gray hairs in a specific patch, specific part of the head, only thing is that you have to confirm, ask him whether you have colored it. That is a question you have to put, because many times there is a fashion to color the hairs. Previously, there was a fashion that they want to make it black. Now there is a fashion they want to make it gray. So as the time changes, the fashion changes. So someone makes it golden, someone makes it brown. First question should be confirmed that whether they are colored. And if it is not, then it has a meaning. So you have to look for, if it is in a patch, specific patch, only a gray color hair, remedy is very clear. Only Sorainum given in the repertory, only Sorainum. So you get all those things in it. And these are nothing but the part and parcel of your physical constitution of the person. So right from the head to the toe, the things guides you towards the thing. If the patient comes with a typical tinea pedis, there are eruptions between the toes, very common entity, washerwoman's remedy. They used to work in water and suffers from it, and that's why sepia is one of the important remedy in tinea pedis. So these things are very essential hints in your practice. They guides you towards certain thing. If you don't have anything in your hand, ascertainable physical constitution is the first thing which you should not miss. Are you getting it? So there are many more. If you open the repertory, you can find it out many more. And these are the things which are very, very essential when you don't have anything to prescribe in your case. If the patient who is not able to talk, these are the things which guides you toward the prescription. And that's why, in order to investigate a fundamental cause, the first cause which you have to look for is ascertainable physical constitution. These are total 7 points, and these are 7 points. One should write it down, fix it in your mind, and understand them properly. Finished, you can treat any chronic disease. Then it never becomes a problem. Then it's too simple to reach to the remedy. Patient who comes to you with a typical presentation of vitiligo of both the eyes on both same sides, and it is type 1 vitiligo. The eruptions which are there. So what you can think of? What you can think of? Which is visible to your naked eye. Finished. You can find it out. Ascertainable. Why ascertainable means visible? It is visible to your eye. That is what is ascertainable, Rutila. First important entity, ascertainable. First, Hahnemann always goes for from simple to difficult. Simple is what is visible is simple. What you can look for is simple. So if a patient who is having bilaterally symmetrical eruptions, there is a rubric in your repertory in the skin chapter, eruption symmetrical. And very few remedies are there. Arnica is there, cipilinum is there, thyroidinum is there, and these are very important in your practice. So you can find it out, all those things, and you make a habit of finding it out, these rubrics from your repertory. Just go with chapter by chapter and find it out what are the things which are given in the repertory which you can visualize in the patient. So if you are able to visualize them over there, then you get many more things. Easily you can catch. And these are the entities which he tried to explain in the first important point, that is ascertainable physical constitution of the patient, especially when the disease is chronic. Is it clear now? So there is a homework for you. Open your repertory and go through each and every chapter and find it out which are visible entities which you can find it out in the form of rubrics. There is one patient who came to me with a severe sore throat, and when I asked to open his mouth, he was coughing off and on with a severe irritation in the throat, and I asked him to open his mouth. I saw his throat and his uvula was elongated and it was turned to right. It was visible. This is part and parcel of that disease as well as his constitution. Then you have to, yes, if you open the complete repertory, throat chapter, elongated, rubric, uvula sub-rubric, bend to right is sub-rubric, and then you get only Barataka over there. So these are things which are very important. Sometimes these guides you towards the thing. And these are the things which you can just confirm with your naked eye. So Hahnemann was very clear regarding his thoughts. And that's why he has explained a simple thing. Just find it out. What are visible things which you can find it out in the patient? And these are very, very, very essential in your daily practice. Okay. So first point today we have discussed is ascertainable physical constitution. The second point is moral and intellectual character. Now, first important thing is what is moral? Moral means what? Anyone? Any idea? What do you mean by moral? The person who follows the social norms is a moral. We used to create a social norms in order to live a life in a normal manner. so that everyone, life becomes simplified when you create certain norms. And when social norms are followed, social norms are developed, and when one follows the social norm, he is called to be a moral. One who never follows the social norm is immoral. And what you have to look for his moral character. Why it is necessary for to find it out moral character? Because moral character defines you a miasm. Stoic personality is generally commonly amoral. Unless and until someone excite him, he never goes to fight, he never reacts. He's happy in his life and he never wants to trouble the others. But other two miasms, which are of a venereal origin, they are immoral. They are quite immoral. The psychotic is absolutely immoral, but who never wants to show his immorality. He hides his immorality. It remains hidden with psychosis. But syphilitic, they are immoral, and everyone finds it out they are immoral. At least they are trustworthy that they want to show their immorality. But this character defines miasm. And on what basis you define patient is not moral or immoral? How will you find it out? कसं शोधणार? Which are the things which will guide you towards the morality of the person? First important thing, when you deal with the patient and discuss with the patient the case, the way of talking, very correct. Dr. Umashi has mentioned over there, the way of talking, the patient's behavior. Patient's behavior is very important. See, this is two important things. Patient's behavior guides you very clearly. The way he enters in your clinic, immediately you can find it out. How the patient comes, how the patient expresses, in what way he enters. The way he enters, the entry itself defines how the person is. He knocks your door, asks, Doctor, may I come? This is simple. These are norms which are created. And another person who comes and opens the door directly, you get disturbed. You are dealing with someone, all of a sudden someone enters in your cabin, disturbs the person. What is the rubric for that? If patient enters in your clinic directly, without, and he opens door directly over there, what's the nature? It is abrupt. It is abrupt nature. This is abrupt. So see the morality on one side, and here abrupt nature, exactly opposite of it, and which defines the individuality of the person. The person who enters, knocks the door, then he asks, then he takes permission, then he enters, then he worships, namaskar doctor. If someone is sitting out besides you, he also gives namaskar. He says like that. What is this? This is what is his nature. These are social norms which you used to follow. This is the way of communication with which we approach. These are social norms with which we approach. When we have to deal with someone, we pray for him and then we start the communication. This is the method in our culture. So his moral personality, the rubric is, if the person comes, yes, very correct. Sakshi, she has written, reverence to those around him, very important. These are the things which you have to find it out. So his moral character, another person who enters, and the way he talks, the talking is also important thing. The tone of the person, the talking tone, again defines how the person is. Patient comes and he is talking with the assistant who is there over there in or the receptionist who is there in his cabin, and he asks, tell the doctor I have come. Is there anyone sitting inside? He asks like this. And when he enters in your room, may I come in, doctor? See, this polarity is always there between in psychotic personality. They comes with this. These are the psychotic personalities. These are the persons who behave according to the, here the rubric is, yes, you know the rubric. Yes. Contemptuous, hard for inferior and kind to superior. This is very simple rubric. So these are the things which you have to catch. The nature of the person, the talk of the person. There are some people who comes and sits like this, doctor, they talk like this. This nature, this is very typical. They are syphilitic. Their talk is syphilitic. It disturbs you. They are not following the norms. They are not concerning that they are talking to a doctor. And this is what you have to catch. Depending on which you can catch how the person is. So moral character defines the individuality of the person, and that individuality gives you the remedy. So you have to find it out, all those things, and this is the way you have to approach in learning. So we have finished only a moral aspect. The intellectual character we will discuss in tomorrow's session, because it is again a big entity which we have to learn. Problem is that intellectual character, to understand the intellectual character, we require intellect. This is more important. So tomorrow we'll go for it. We'll stop over here. In today's session, we are highlighted with the only one first aspect, that is when you deal and want to investigate the fundamental cause, what is required is the ascertainable physical constitution as the first part. So this is too important that one should not miss this while learning, and these are the entities which we have to learn. These are very essential things which one must know. Okay, so is there any question, query? Yesterday someone have asked some question, but because of not having time we have not discussed. Any query? We have 3 minutes with us. Recurrent eruption in buttock area, pus like sticky discharge, gave silicia but not much improvement. First important thing, Dr. Prasanna, I want to ask, what is the diagnosis in that case? What is the diagnosis? Very important. Diagnosis is too important to understand. Then you have to think whether it is a fungus which has which that fungus which is secondary bacterial infected, that might be a reason. It might be a recurrent boil which is there. You have to understand what exactly it is, then you can think about it. Second important thing, that if the discharge is sticky, if it is not of a pustular, then why to think about silicia? Second question. If it is sticky, like exudate, then you have to think about the calimiraticum, the plastic exudate. So first important thing, you diagnose what it is. Diagnosis is too important, which guides you towards certain things. So should not miss the diagnosis. So you can get exactly what
Sorry. Sir, it usually comes for once in 15 days or something, 2 to 3 eruptions at a place, and it goes off on its own, sir. First, I gave him silesia, later fluoric acid also was given, but again, it is repeated continuously.
First important thing, my suggestion is that what it is exactly, to find it out, or take a picture at least, so that you can find it out exactly what it is. And if it is possible, if it is diagnosed, then we can think accordingly. So if it is pustular origin, you have to think about silicia. If it is not of a pustular, then you have to think about other remedy. So first thing is that what it is. That is more important.
Okay, actually it is not showing any pustular or anything. Day long when he wears his dress or something and goes out and come, it is just like that sticky discharge is coming out, sir.
Then it is definitely not a silicia. So if it is not silicia, it will not recover under the silicia. It might be a calimere.
Okay.
Might
calimere.
be.
Okay.
Think about that.
Okay. Okay. Thank you.
Yeah.
Okay. Sir, one more thing.
Yes.
Sir, can you please take a class on GE or this? So esophageal reflux problems are coming.
Okay.
Maximum cases in our area, we are facing that problem. So can you please take a class, sir?
Definitely, whenever time permits.
Okay.
Yeah, sure. Okay.
Sir, can you
Okay,
please
sir.
repeat the homework, sir? I just missed.
Homework is that you
The
have
homework-
to write out all ascertainable physical constitutional rubrics in different chapters from Kent's repertory. If
All right,
open
sir.
the chapter, for example, head, then you find it out what you can visualize in head in those rubrics. For example, baldness, which is visualized.